Hey friends, welcome to Omar's How-Tos and Reviews. Today we're doing a video on diabetes, and it'll be a simple explanation video. Now these simple explanation videos, they're to increase your understanding of these topics because they're pretty important. They affect a lot of people's lives, and I kind of want to give you an explanation for reasons that, say for example, you've been diagnosed with diabetes, or a loved one's been diagnosed with diabetes, or you're trying to find out what it is because you're kind of like you've heard about it and you're trying to build your knowledge base. So in this video, we're going to be talking about like diabetes in general, not very specifics about like each individual type of diabetes. And there's four main types. So there's type 1 diabetes mellitus, which is typically associated with autoimmune disorders. So it's autoimmune diabetes. There's type 2 diabetes mellitus, which is associated with increased blood sugar levels from intake. Like, for example, you eat a lot of desserts, and that's related to diabetes type 2. And then there's diabetes insipidus, which is diabetes which is caused from water loss. And so if you have diabetes insipidus, you either have an issue with your kidneys or your pituitary gland, which regulates water loss in your body. So in general, diabetes is a pretty big disease, and there's a lot of different subsets. And if you have type 1, everything from type 2 might not apply to you, and vice versa. And the treatments are different, the complications are different, the way you're gonna feel is different in all different types of diabetes. That's kind of like the baseline of this video. I just wanted to come across that there is a few different types of diabetes, and they're all kind of a little bit different, and they're approached differently. I'm not gonna go into each individual type of diabetes. I will make videos, or I have videos for diabetes type 1, type 2, and diabetes insipidus, which I'll approach, and you can click to go to those. But I kind of just wanted to explain what diabetes was in general today. So diabetes is elevated blood sugar, elevated sugar in your blood. And what that means is there's a lot of things going on in your blood, and one of the things that's floating around in your blood is sugar, and sugar comes from things we eat. So sugar is like one of those things. It's demonized by a lot of people that try to educate for diabetes because we want to emphasize that, hey, like eating candy bars are bad, or eating this way or that way is bad. And they don't point out that your body needs sugar. Your brain needs sugar to function. And it needs a certain level of sugar. Now, the way I would like to describe it is like your body needs a certain level of sugar. And if you go above that level, it can be harmful. And if you go below that level, it can also be harmful. So you need to keep your body in that sweet place. And anybody who has diabetes has trouble keeping your body at the proper sugar levels. And so if your blood sugar is too low, you'll feel a lot of the time you'll feel lightheaded, you'll feel weak, you'll feel like you can't stay awake, you could pass out. If you have too high blood sugar, you can feel completely different effects, or you might not even have any effects. So it's a big balancing act that your body pulls off, and when it goes awry, a multitude of things can happen. It's not just, oh, like this person has diabetes, this is definitely going to happen. Everybody is individually like different. So what I would recommend if you have diabetes is that you see an endocrinologist, because an endocrinologist can tell you exactly what type of diabetes you have and how to treat your specific diabetes. And a lot of people might be wondering, is diabetes reversible? And that's a very good question. Diabetes, as we know it, depending on the situation, is something we treat with drugs. That's where we're at right now. We're not at the point in medicine where we can reverse diabetes entirely for everybody. Now, there might be some research going on, and maybe if you would like me to go into it, I'll go into the new types of research they have for curing diabetes. But right now, as like everybody treats diabetes, is medications and lifestyle. So this is not an easy video. Crap. Diabetes sucks. Man, diabetes is terrible. Diabetes. it's like one of those things, like you're fighting this battle, and it's we have the weapons to fight it. We have the weapons to fight it, but no, like there's so many things going on. There's no clear there's no clear direction that people take together as a community. Healthcare workers, they're not united on providing a clear message of nutrition and just overall wellness. I think it's a pretty big tragedy, and it's affecting our society. It's affecting so many different parts of society that, like, I don't know, like it makes me sad to think like this is something that we can fix and we just don't. There will be a cure for diabetes, but is that what we're looking for? Are we looking for the easy fix on all these? And we're waiting till the easy fix is there until we can actually make a move, make a change, and come together. I don't think that's how it's supposed to go. I don't think that's how America is supposed to be, waiting for easy fixes. I think we should really like get into it and dive deep into why we're waiting for that. Because yeah, there could be an easy fix for diabetes soon, but there's so many other diseases that we're so far off of an easy fix. We can't get into a habit of looking for easy fixes. So what I would recommend to anybody who's learning about diabetes or dealing with diabetes personally or otherwise is that you look at it like a very serious problem in your life. And everybody does, regardless if you have it or not. It's a serious problem. We all have to come together, because when you have diabetes and you're getting hurt by diabetes, and that sugar, it can become a poison in your blood. That damage, it's silent. You're not going to feel somebody hitting you with a hammer or a bat. You're not going to feel an infection. You're not going to get a fever. But once that damage starts happening, it's not going to stop. It's going to keep going. It's going to take your leg. It's going to take your vision. It's going to take your health. And once it takes your health, there's no going back. There's no easy fix for that. So diabetes is something I encourage you to educate yourself about, regardless of if you have it or not. And then I hope that in this simple explanation videos that I can really kind of like give you a baseline understanding, because man, it's a vicious disease. It really is. That was a tangent I was not expecting. That's 1/3 of the people with diabetes are not even treating their diabetes. That's pretty astounding. So you want to make sure that you're going to a doctor regularly, making sure that they check your A1C level, which is the A1C is actually pretty important. So let me break down to this. So your A1C is the quality of your blood sugar control over the past 3 months. So if the quality of your control, meaning are your blood sugar levels rising really high and staying there over the last 3 months, if your A1C is elevated, that means that they have been out of control in the past 3 months. And if your A1C is normal, all it means is that in the past 3 months, you've had good blood sugar control. So when you have diabetes, or when you think you have diabetes, or you're just trying to maintain your health, you have to know your A1C levels, and you have to go see a doctor regularly. That's the only way to find out. And that is your answer on how to treat my diabetes. Go see an endocrinologist. Go see your family doctor. Go see a doctor that can take your blood, take your A1C levels, and see where you're at. Because I think that in America, our healthcare system has kind of failed us in terms of regulating this. It's come down to like adding more and more insulin to people who their treatment needs something else. If their diabetes is progressing, which means it's going on a steady slope in a bad direction, that means that the care is not there. And so you have to own it, or you have to find another doctor that will help you own it. Because once something terrible happens to your body, you break the bones in your foot and you lose that foot, or you damage your eye and you lose your sight. then that's it. That's permanent. That's permanent damage, and I wouldn't want that to happen to anybody. In America, there's 30.3 million Americans, or 9.4% of the population, that has diabetes. And out of those 30 million Americans that have diabetes, about like 7.2 million are undiagnosed. So go and check your A1C levels and go see your doctor. And then in those people that have diabetes, there's a large percentage of older people. Actually, they're estimating right now about 25.2% of the people above 65 have diabetes. That's 12 million seniors, diagnosed and undiagnosed combined. And there's about 1.5 new million cases of diabetes each year. And there's something called pre-diabetes. And they're estimating that 84 million Americans ages 18 and over have pre-diabetes, which really gives them a high chance of getting diabetes. It's a huge issue. And diabetes remains the 7th leading cause of death in the United States as of 2015. 79,535 people died due to diabetes. And I'm sure that's a low estimate. So this is a pretty big issue. So I recommend that you educate yourself. I recommend that you go see my other videos. I recommend that you eat healthy and control the things you can control, and see the doctors that you need to see, and do the things you need to do, and help people around you that can't do that, or don't know it, or have problems getting to see the doctor, or don't even know that they're at risk. It's a pretty big task that medicine has failed us. And when I say medicine, I'm talking about the hospital system in America has failed us. And I think it's going to come down to like, hey, do you want to live a diseased life, or do you want to live a healthy life, a happy life? And I think that everybody wants the latter. I do. I want it for you. I want it for me. I want it for my family. And I want us to really just think of health as not a doctor problem, not a nurse problem. Not any individual is responsible for your health except for yourself in this day and age. I truly believe that, and I hope you see that too. Because when you see that, then that's the first step into becoming a very healthy person and a happy person for the rest of your life. So that kind of got a little bit more intense than I was expecting. I hope that it helped you, and I hope that you continue to further educate yourself in this topic. Have a good day, and eat something healthy.